Hello, Renew Health Warriors. Welcome to Renew Health Thursday. I'm Dr. Jacqueline Owusu. I am the owner of Renew Health Clinic in Columbus, Georgia, the owner of Dr. Owusu Skincare and Wellness, and the senior pastor for for Living Free Now Church in Columbus, Georgia. So you're welcome, and anytime you want to visit us, we're in Columbus, Georgia. You can. Welcome to our channel. Our channel is basically promoting a healthy lifestyle through incorporating the consumption and increased consumption of fruits and vegetables, so you can use that to detoxify yourself, regenerate yourself, and heal yourself, so you can present your best self to the world and to yourself. Okay. So with that said, we do have several programs that we do here. We have the 28-day Renew Health Transformation Program that we do monthly. We also have the Renew Health Ultimate Weight Loss Program that you can just join. You don't have to wait for the monthly program to join. You can just join at any time. And we also have private coaching. So if you need any of that, just let us know and we will accommodate you. You just call the number of the clinic, which is below, and we'll accommodate you. In addition to that, if you are anywhere in the world and you want to support us, we have awesome products. We have herbal products that helps with this journey, as well as we have a cell support power food supplements that is excellent to supplement the nutrients of your cells for that nutrients to get to your cells, as well as the male support, which helps men with prostate problems, erectile problems, or even just strengthening their male reproductive system. Then we have hair care products, we have facial care products, we have body care products. So if you need any of that, don't hesitate to contact us, and that will also be a way for you to support us. So with that said, thank you. I have been going through the adrenal gland. I'm going to go through kind of different glands with different symptoms and the different diseases. But overall, you're going to realize as you continue to watch these videos that everything affects everything else. Okay? We are not individual bodies. We are one system. And the way God created it, it's so amazing that everything is kind of interconnected. So I started with the adrenal gland. If you haven't seen that, watch the adrenal gland part 1, part 2. I think this is part 3. So I'm going to try and wrap up with part 3, because I have realized that my target audience is probably a middle-aged person who really is not athletic. They probably don't really exercise. They have a lot of medical problems going on, and they just want to feel better. They just want to get better and feel better and get off all these medications that they are on, or maybe even reduce them. That's my average, target person. My average patient is like that. So I'm not here. If you are, here wanting to have exercise things, or become muscular or athletic, then this is not the channel for you. This channel will help you to eat better and to express yourself better in terms of the foods that you take. But in terms of my average person just wants to feel better. My average person probably has been eating meat and dairy all their lives, and now I'm telling them eat fruits and vegetables, and they're like, what? And they just want to feel better. And they have realized, because I get reports every single day, that when they do it and they finally listen to Dr. Owusu, they get better, they feel better. I had a lady write me yesterday. She said, I have not felt, she's 80 years old, and she said, I have not felt as good as I felt since I started listening to and incorporating some of these things that you said. Another lady came to my clinic and said, can I hug you? Can I cry? We both cried together. She just was so, from where she started and where she is today, it's amazing in 3 months. So God has a way of wanting to heal you. Your body has a way of wanting to heal you, but you just have to give it the right platform, the right nutrients to be able to do that, okay? So with that said, please do watch Adrenal Gland part 1 and part 2. I want to wrap up Adrenal Gland today. So I kind of want to give you an overview. Adrenal gland, we said, is located, there are 2 of them. It's located both on the right kidney and on the left kidney above that. That's like some small triangular glands, and they do a lot. It's divided into 2 parts. You have the middle part, which is the adrenal medulla, and you have the outer part, which is the adrenal cortex. So the adrenal medulla, it has neural tissues, right? Nerve tissues, neural tissues, and they actually secrete neurotransmitters like epinephrine and norepinephrine. Epinephrine is also known as adrenaline, and norepinephrine is also known as noradrenaline. And these neural tissues are usually synthesized and excreted into the the bloodstream, affecting different part, or into the nerves communication with different parts of your body. So the adrenal medulla will communicate with, and they get their cue, right, or their, I'm trying to look for their cue, like they get, they get their activation, or for the activation for them to synthesize these from acute stress. So where's that coming from? Your fear center in the brain will get activated, right, when something is going on, and then it will activate the hypothalamus region, and then that part will just which there is your central nervous system, then divide into your autonomic nervous system. Then your autonomic nervous system is your sympathetic and your parasympathetic. Those are stimulated. That is like from your thoracic to your lower lumbar, and then from there it signals to the adrenal glands and say secrete these hormones, because there's something going on. These hormones, these catecholamines will then go to different parts of your body and starts affecting it. So with that also there's the adrenal cortex, and the adrenal cortex will have it's divided into three parts. The adrenal cortex is the outer part. So the adrenal medulla is the middle part, which secretes these neurotransmitters, which is the epinephrine or norepinephrine. The adrenal cortex is the outer part, which is separated into three parts, which is the zona glomerulosa, zona fasciculata, and zona reticularis. So each part, it has different things that it produces. So now let's go to the hypothalamus, which is your brain. See, when I talk about everything is connected, now you're seeing. So in your brain, you have something called the hypothalamus. The hypothalamus will then secrete, right? It will get a signal that the body needs something. Then it will secrete releasing hormones. And these releasing hormones will then go to the anterior pituitary. Because the pituitary gland, there are two parts to it as well. You have the anterior gland and you have the posterior. Okay, so the anterior gland, it's directly, it gets its stimulation from the hypothalamus, right? So from the hypothalamus secretes many hormones. And so when we talk about hypothalamus later, you'll see that it secretes like thyroid releasing hormone, thyroidotropin releasing hormone. It secretes the corticotropin releasing hormone. It secretes the gonadotropin releasing hormones. It secretes the growth hormone releasing hormone, and then it also secretes something called prolactin inhibiting hormone, as well as the thyrotropin releasing hormone. That also stimulates something called prolactin to be released from the anterior pituitary gland. And that prolactin is kind of important when a woman is getting ready to have a baby and she needs to produce milk, right? So the prolactin was released, and then it goes to the mammary gland and it produces milk, okay? Not secrete milk. There's a difference between the production of milk and the secretion of milk. So it produces the milk. So then it's there, and then in the hypothalamus also releases something called oxytocin and antidiuretic hormone. And that one goes straight to the posterior pituitary, not the anterior part, the posterior. And this is all nerves. So it's a nerve communication, straight from the hypothalamus to the posterior. And then from the posterior, that hormone is then released into different parts of the body, like your mammary glands, and then the smooth muscles of your the uterus, right, when the woman's getting ready to have a baby, and it will cause the smooth muscles to relax, right, so that the baby can be able to be pushed out. So you see how your whole body is connected, and it's so important, this hormonal and nerval communication. So then that oxytocin is the one that actually helps secrete the mother's milk. So the prolactin, right, helps mix the mother's milk, but the oxytocin then helps secrete the mother's milk. You see that? So you need both prolactin and oxytocin to work together. And it's also that love and feel good kind of hormone, right? So it's very important. And I just brought that up to kind of show you how our whole body, from our head all the way down, is connected via, you know, the hormone regulation, as well as, you know, the nerve communication. So now, so let's forget about the posterior part for now, because we later on on our lectures we'll go through that. Now we're going to our anterior part. So the anterior part, that hypothalamus is secreting all of this, right? Then that secretion is going to the anterior pituitary gland. The anterior pituitary gland, one hormone I want to touch here, because starting next week I think I'm going to start on the thyroid gland. So one hormone I want to touch here is the adrenal cortical tropin the corticotropin releasing hormone would go to the anterior pituitary, which will now release the adrenal corticotropin hormone, right? ACTH. ACTH will then go to the adrenal gland, right? And then it will affect the zona glomerulosa, which is the one that I was telling you about, the zona fasciculata and the zona reticularis. What comes out of the zona glomerulosa? Aldosterone. What does aldosterone do? Aldosterone actually goes to the kidneys, and then it starts the regulation of sodium and potassium. So for example, if your blood pressure is low, it's the aldosterone that's stimulated, right, to go to the kidney, and it goes to the kidney and it tells the kidney, hey, don't secrete too much sodium, right, because I need the sodium. So when sodium comes in, what comes in with sodium? Water. So then it brings your blood pressure up. Do you see how it does that? And so it's very important, and potassium is excreted. So there's so much to it. I just don't want this to be a medical school education. That's why I just kind of like want to give you an overview. So now so that's kind of what's going on with the zona glomerulosa. What's going on with the zona fasciculata? But you see how the kidneys is also involved with the aldosterone and the zona glomerulosa. What is going on with the zona fasciculata? What's going on with that is the ACTH, which is produced by that or secreted by that anterior pituitary gland, comes to the middle part, which is the zona reticularis of the adrenal cortex. And then what it does there is it stimulates it to produce glucocorticoids. And one of the most important glucocorticoids we need to know about, which I discussed last week, is cortisol. So cortisol is released both in acute stress and chronic stress, right? And the chronic stress is what causes all the problems that I discussed in last week's video. So it is very important to control your cortisol level, okay? Because cortisol, and remember, all these hormones that are being synthesized, their precursor is cholesterol. So they are also anti-inflammatory. Some are anti-inflammatory, some are catabolic, meaning that when we start talking about thyroid glands and the thyroid hormone and the growth hormone, you will notice that thyroid hormone affects the adipose tissue, which is your fat, affects the liver, affects the skeletal muscle, affects the bone. You see what I'm saying? It affects the heart. So it affects all of this, right? How? Via the norepinephrine. Some of them is going to affect the receptor, is going to be bounced directly. Some of them is going to enhance some of the receptors on there, right? And then it's going to cause it to have it effects. So it is very important. Now, when we talk about thyroid gland, you're going to see that thyroid hormone is going to try and increase your in the fat, is going to increase your adipose tissue. Increase the breakdown of your fat, right? In the liver, is going to increase the production of glucose. In the both thyroid gland and thyroid hormones and growth hormone does that. And in the skeletal muscle, which is important, it's going to actually make protein. Okay, so it's going to make protein to support, right, the muscle. Whereas cortisol, that's the difference between the thyroid hormone and the growth hormone. They all work on the same things. Cortisol does the same thing. It also works on the adipose tissue to break down fat, right? It works on the liver to produce glucose. So you go through gluconeogenesis and glycogenolysis, all right, which is the production of glucose from new precursors, non-carbohydrate precursors like, let's say, fatty acids, amino acids, lactic acid, glycerol, all of that coming together to go through a process and a pathway to make glucose. That's gluconeogenesis, making new glucose from non-carbohydrate precursors. Then you have glycogen got glycogenolysis, which is basically taking the glycogen that's stored in the liver cells, in the liver, to break it down, because glycogen is like polymers of glucose. So you're going to break it down, right, to release those polymers of glucose to be individual glucose. So that's glycogenolysis, okay? So cortisol helps to do that. Thyroid hormones help to do that. And growth hormone helps to do that. Once you get all that done, then why do we need all this nutrients in the blood? Because the body needs it. Especially when you are in acute stress, right? The body thinks that it has to fight or flight. It has to move. So it's trying to get as much nutrients to the muscle to move, right? Your skeletal muscles to move. It's trying to get enough glucose to your brain so it can think on its feet and kind of help you and move. It's trying to get energy to different parts of the body so you can be ready. So that's what this is happening. Also, when you're starving, your body wants some glucose, right? Your brain, even though you might not eat, right? You might be fasting, you might be sick, you might be whatever, you might be sleeping, but your body still is functioning. So it needs this breakdown to be able to keep functioning, okay? So cortisol does all of that, but in the skeletal muscle, the difference between thyroid hormone and growth hormone, when we go through that, you'll see is that the cortisol is trying to break down the protein, whereas thyroid hormone and growth hormone are trying to make the protein. Cortisol is trying to break it down so you can get more because you're trying to get ready to fight or flight, okay? And then in the bone, it's also breaking down stuff. So when you notice that, like I talked about last video, if that happens, then your muscle mass is going to go down, especially if you have continual stress that requires continual cortisol release, right? Or, just every single time your cortisol is high. Then your muscle mass is going to go down. It's going to break down the fats from the extremities, and it's going to cause visceral fat, right? And then also the interesting thing about the whole cortisol estrogen rotation is that as you get the visceral fat, right, where you get the belly fat, then that belly fat itself releases inflammatory cytokines, and they cause more elevation of cortisol. And then it also produces estrogen, and it causes more elevation of estrogen. So it's like a vicious cycle, and you need to be very, very mindful. And so we talk about cortisol, what it does. It goes to the adipose tissue, the liver, the bone, the muscles, the heart. So it increases heart rate, increases blood pressure, just like the norepinephrine and epinephrine in the adrenal medulla, because that's what they're doing, right? So all of this can be controlled by how you manage your stress and also the foods that you eat. Try and control the inflammation in your system. I always tell you on this channel, the foods that we're eating, the acid-like foods that we're eating, like our animal proteins, our dairy, our refined sugar, refined carbohydrates, oils, those are all causing inflammation, acidosis in your body, which goes to inflammation. Inflammation will then cause these cortisols to remain high. It will cause your estrogen to remain high. You see what I mean? So you want to be able to kind of control all of this. And now we'll go through some of the steps to control this and to relax yourself. So then we talk about the zona glomerulosa with the aldosterone, the zona zona fascicularis with the cortisol. Now we talk about the zona reticularis. Those are your sex hormones. Most of your sex hormones are made in the ovaries for the woman and the testes for the male, but some are made here. And so some will be like your DHEA is kind of made here, and then some, it's a small amount, but it's still significant. Because even your progesterones in your gonads, right? They need the prohormone, which is the DHEA, to be able to make the progesterone, right? So once the progesterone, the estrogen and the testosterone is like acid hormones because it's breaking down stuff, right? Because what is it doing? It's breaking down the uterine lining, it's building it up, making it thick, then it's helping to break it down. Then the testosterone is helping with your prostates and all of that, right? So without the counterbalance, you need the counterbalance, which is the progesterone. And without that counterbalance, then you're gonna be, be estrogen dominant, right? Which is gonna cause a whole host of problems like your fibrocystic problems, your uterine problems, your uterine cancers, your breast cancers, your ovarian cancers. Do you see how it's like a vicious cycle? And then with the men, you get prostatitis, you get prostate cancers, all of that. So you want to be able to control all of that, and it starts with the foods that you put in. Yes, environmental toxins are there, but some of the environmental toxins we can't control. We can control some though, by especially even like if you drink water, don't drink it in plastic bottles. When you get canned food, get the non-GMO stuff. So look at when you get stuff, wash it very well because of pesticides and herbicides and all that. So these are stuff that how you can control a little bit of your environmental stuff. Now, some are still going to sneak in, but if you do concentrate on your large consumption or increased consumption of fruits and vegetables, then even when it sneaks in, your body will try and detox it. Do you see the difference now? That's why the foods that you put in this vehicle, in this temple, is so important. So the other thing with the sex hormones that I want to talk about real quick is it also controls your libido, which is your sex, how sexual you are, or your you wanting to have sex. Okay, so it controls that. So you want to be able to make sure that these are in balance, so you will not be hypersexual or low sexual, so low libido or high libido. So you want to be just right, so you can be be good for your partner, okay, and be good for yourself. So that's kind of in the thing about the overall about the adrenal cortex and the adrenal medulla. Now, the cortisol. This is one thing I wanted to say, that if the cortisol, if it's too much, right, then it will go and do a feedback inhibition to the hypothalamus, right? Because remember, the hypothalamus was producing that releasing hormone. So it will go back and feedback inhibit that, the hypothalamus, and also feedback inhibit the pituitary, the anterior pituitary gland. So what happens when that happens? So that means when you have a high cortisol level, right, and it inhibits the pituitary, the other hormones are not going to be released, or not effectively, right? So that means, and what are some of the hormones that are released? I told you we're going to talk about it next week. Is your thyrotropin releasing hormone, which is your thyroid hormone. So guess what's going to affect? It's going to affect your thyroid stimulating hormone, which causes your thyroid to make hormones, right? So you're going to be hypothyroid. When you're hypothyroid, because one of the things thyroid gland does also with the parathyroid is it controls the regulation of calcium, okay, from the bones. So if calcium is low in the blood, then that parathyroid hormone is released, and it tells the bones release, break down some bones so you can basically make some release some calcium. You see that? So if your thyroid is low and your parathyroid is down, then you're going to have a problem with calcium utilization, which is going to affect your overall function, and also even how your cells utilize stuff. Okay, so it's very important. I'm telling you guys. So the way you eat has a lot to do with how you function. Okay, so and then the bone, once it's not it's not functioning well, right, because it's not getting the calcium regulation that it needs, then you can have osteoporosis. So elevated calcium cortisol level can cause hypothyroidism, and can also cause, which is underactive thyroid, and can also cause osteoporosis. So that's very important for you to know. Also, that that if you have a lot of inflammation going on in your body, you also have that cholesterol plaque in your body, in your blood vessels, the walls of your blood vessels. I talked about that in the other video. And you also have cholesterol in your blood. Okay, so you gotta remember that. So with that said, I want to now talk about. We already talked about the adrenal gland, the adrenal medulla. That it affects the norepinephrine. The epinephrine affects the adipose tissue, breaking down the fats in your adipose tissue, the liver, which causes increase in glucose, the muscles, breaking down muscles to amino acids, protein to amino acids, the heart, increasing the heart rate, the vessels, increasing the blood pressure, the slowing down the GI tract, and then the lungs, opening the alveoli, the bronchioles, so that you can be able to breathe in, because you're about to take a breath, because those are your fight or flight neurotransmitters. Remember, so strengthening your cells. I want to strengthening your cells by detoxifying and regeneration, regeneration. Yeah, of your cells are very important. But and it starts with the foods that you eat. Increase your consumption of fruits and vegetables. I tell you, one of the simplest ways to do it is take one day and just eat all fruits and water. Just eat all fruits and water. That's going to start your body. Your body's going to get the proper nutrients it needs. And then what is it going to do? It's going to start healing and detoxifying itself and then regenerating your cells. The other thing you can do is water fast. I tell people, if you want to water fast, speak to your doctor about it. But you can do like a 1 day water fast. Just drink water and just let your body rest. So let your body rest from digestion and then start healing. But speak to your physician about it, or a healthcare provider who's who's versed in that. So well, you say, well, doctor, what should I do? I'm not saying I prefer you not to eat meats or dairy. That's what I prefer. But you're not, because my average client or the person who's watching this is used to eating meat every day. So I'm like, okay, if you used to eat meat every day, then cut it down. If you have 7 days, cut it down to 5 days of not eating meat and eat fruits and vegetables and potatoes and rice. And then the other 2 days, then you eat your meats. You see what I mean? So cut it down and don't let it be the 7 days a week, because it is causing, you having all this congestion, right? All this flu-like symptoms, all this tiredness and weakness, and your organs and cells and tissues not functioning, to the optimum that it should. So how should we do this? How should we start correcting some of this that we can control? I told you can't control the weakened inheriting gene that you received from your parents. Can't control that. You cannot control a lot from the environment. You can't control it by not drinking from maybe plastics, or getting non-GMO stuff, or not getting like estrogen like stuff that to come in, exogenous estrogen to come in, and all that from soy product, a lot of soy products that are processed. But you can basically cut back on the foods that you choose. So you're eating a lot of fruits and vegetables, cutting back on the meats, the dairy, or animal flesh, dairy, refined sugar, refined carbohydrates. You see what I mean? And just consuming a lot of raw, fresh fruits and vegetables. So that's one thing that you can do. That's number one. Number two, exercise. Exercise helps you a lot, because when we start talking about the lymphatic system is the sewage cleaner of your body. It takes all the junk. It's like the garbage collector. So it takes all the garbage that is coming in from, your cells pooping, it's collecting all of that and it's putting it out, right? So now you need to exercise, because the lymphatic system does not have a heart. Like the blood has a heart to pump to different places. So the lymphatic system, your exercise, your movement is what moves the lymphatics. Okay, so it's very important to move so the lymphatics can also, not be stagnant and move. And then also the foods that you eat will help the lymphatics not be congested, so they can move, well. Another thing you can do is meditation, especially for those who are chronically stressed and have, relationship problems, job problems, financial problems, children problems, this problem, that problem. It's also affecting your sleep. Right? So you want to be able to meditate. When I say meditate, I think I've done this with you in other shows. Like taking a deep breath. Take a deep breath 5 times and blow it out. Look at how I'm doing it. I'm taking a deep breath, then blow it out your mouth. One more time. Blow it out. One more time. Blow it out. One more time. Blow it out. You should feel relaxed. That's what I'm talking about, that breathing techniques. That helps you relax. It helps you just take your mind off stuff. It just helps you be in your own zone. Okay? Deep breathing, exercising, meditation, praying, listening to music. One of my favorite things is to listen to like those spa music with the mute, with the waterfall, and the this relaxes me, right? It brings me to a zone like I'm in Bahamas and I'm just relaxing. You might not have the money to go to Bahamas, but you can bring Bahamas to your bedroom. So that's how you do it. And then, so we talked about exercise, we talked about eating right, we talked about meditation. Read, do some of your favorite things. Reading, I love reading. It relaxes me. Writing, painting. If these things don't relax you, don't do them. We're talking about things that relax you. If they relax you, you do it. Singing, I love to sing. I can sing all day and I just, I feel relaxed. And so singing, reading, writing, journaling, all of these things, if they playing an instrument, if they help you relax, then do it. Exercising, if they help you relax, then do it. Okay, so this, I wanted to kind of sum it up by saying your glands are controllers and regulators of the cells, the tissues, and your organs of the body. When they are hyperactive or hypoactive, it can create cellular changes, and this can have a highly acidic effect upon the tissues, leading to lymphatic and immune response. So for example, cortisol will inhibit your immune system, which will now, if you have high cortisol, you're going to be prone to infections. You're not going to be healing properly. Do you see all of that? Estrogen, testosterone, aldosterone, their long-term effects without the progesterone or cortisone buffers can lead to like fibrocystic changes or conditions of tissues, as well as tissue atrophy, destruction, and cancers. So people, this is big, and you have control over this. So you got to be able to, find a way to de-stress, find a way to put good fuel into your body so your body can utilize it so you don't feel so tired, okay? And then I want to end with this quote, which I always end with a quote with you because I want to say this. Allow yourself to be proud of yourself and all the progress you have made, especially the progress that no one else can see. Okay? And remember that the happiest people don't have to be the best at everything. They just have to make the best of everything they have. So I love you. God bless you. I know that God loves you more. I want you to succeed. I want you to be as healthy as possible so that you can go to your doctor and present yourself to your doctor. They will ask you, what are you doing? You will tell them what you're doing so that with their help, they can get you off all these chronic medications that you're on, and you can feel your best, be as vital, and be as well, and present your best self to the world. God bless you until we meet again next Thursday. Hopefully next Thursday, I can touch on the thyroid gland because I know that affects a lot of people, especially women. So God bless you, and I love you.